Hello everyone, my name is Greta Naiseli, and today I will be presenting about the 4 types of infectious disease. So they are blastomycosis, teniasis, gas gangrene, and bacterial meningitis C. So this presentation will cover the overviews, causes, the symptoms, the diagnosis, and the treatments of each disease. First, let's look at blastomycosis. Blastomycosis is a lung infection that is caused by a type of fungi called blastomyces, and this type of fungi lives in the moist decomposing matter such as wood and leaves. And now let's look at the cause. People can get blastomycosis after they breathe in the microscopic fungal spores from the air, and then the yeast will colonize the lungs. For the symptoms, some people will develop the symptoms, but some will not. However, the symptoms include coughing, fever, night sweat, chest pain, weight loss, and fatigue. And now let's look at the diagnosis and the treatment of blastomycosis. The diagnosis can be tested by taking blood samples and urine samples to the lab, and also a physician can perform a chest x-ray or CT scan of the lungs, or maybe a sample of fluid from the respiratory tract will be collected and observed under the microscope to see the microbes. And now let's look at the treatment of blastomycosis. After being diagnosed with this disease, the patients are treated by prescribing the antifungal medication by the doctor. Such medication are like intraconazole. This antifungal medication treats mild to moderate condition, and for amphotericin B, it treats severe condition. And now let's look at the other type of disease, which is teniasis. Teniasis is a parasitic infection that infects digestive system. This disease is caused by the tapeworm species known as Taenia saginata beef tapeworm, or Taenia solium pork tapeworm, and Taenia asiatica, which is Asian tapeworm. This disease is infected when we eat raw or undercooked beef or meat. And also, Taenia solium tapeworm infections can lead to cysticercosis, a disease that can cause seizure. So it is very important to seek for the treatment when be infected by this kind of disease. And now let's look at the diagnosis of this disease. The diagnosis can take place by examination of stool sample. So the stool specimens should be collected on 3 different days, and examined it in the lab for Taenia X using microscope. And tapeworm X can be detected in the stool 2 to 3 months after the tapeworm infection is caused or established. And now let's look at the symptom of this disease. Most people have no symptom, or they might just show mild symptom. However, patients with T. saginata teniasis often experience more symptoms because T. saginata tapeworm is larger in size than the other 2. Tapeworms cause digestive problem also, including abdominal pain, loss of appetite, weight loss, and upset stomach. And the most visible sign of teniasis is the active passing of proglottids, or segments of tapeworm through the anus or in the feces. And now let's look at the treatment. After being diagnosed with this disease, treatment is available after accurate diagnosis. So the doctor will provide prescription medication which is taken by mouth. And also, in addition, let's look at the prevention and the control of this disease. One way to prevent teniasis is to cook meat to safe temperatures, and it is also recommended that a food thermometer should be used to measure the internal temperature of cooked meat. And moreover, it is also important to maintain hygiene. And now let's look at the third type of infection, which is gas gangrene. Gas gangrene is a death of body tissue due to the lack of blood supply or a serious bacterial infection. Gangrene commonly affects the arms, the legs, including the toes, fingers, but it can also occur in the muscles as well, and in organs inside the body, such as the gallbladder. Gas gangrene typically affects deep muscles tissue. Like if you have gas gangrene, the surface of your skin may look normal at first, but as the condition worsens, your skin may become pale, then turn gray or purplish red, and then the skin may look bubbly and may make a crackling sound when you press on it because of the gases within the tissue. And the risk of getting gangrene is higher if you have an underlying condition that can damage your blood vessels and affect blood flow, such as diabetes or atherosclerosis. And now let's look at the causes. Gas gangrene is most commonly caused by a type of bacteria called Clostridium perfringens bacterium. In some cases, it may be caused by a group A Streptococcus bacteria. The infection may occur suddenly and spread very quickly. The gas gangrene generally develops at a recent surgical or injury site. In rare cases, it may happen spontaneously without an apparent cause. So certain injuries have a higher risk of getting gas gangrene. So such injuries include muscle injuries, severely damaged tissues, wounds that are very deep, or wounds that are contaminated with stool or dirt, especially those that might occur on the farm. And now let's look at the symptom of this disease. Such symptoms include fever, air under skin, and the pain in the nose, the pain in the area around the wound, swelling in the area around the wound, pale skin that quickly turns gray, dark red, purple, or black, and also a blisters form with a foul smelling discharge, and also excessive sweating, increased in heart rate, vomiting, and lastly yellow skin and eyes, or in another word we call it jaundice, which is a late sign. And now let's look at the diagnosis of this disease. So how is gas gangrene diagnosed? Gas gangrene can be diagnosed by performing a physical examination and ordering various tests. So the diagnosis testing may include the skin culture in order to test for the presence of Clostridium perfringens and other bacteria, and also blood test to check for abnormally high white blood cells count, which can indicate an infection. And the third one is imaging test, such as a routine x-ray to look at the tissue and check for the presence of gas. And then the last one is surgery to evaluate the spread of the gas gangrene within the body. And now let's look at the treatment. Treatment for gas gangrene must begin immediately. Once a diagnosis is made, high doses of antibiotics will be administered intravenously or through the veins. For more serious cases, it may be necessary to begin treatment before the diagnosis even performed. Like dead or infected tissue might need to be surgically removed right away, and also the doctor may try to repair the damaged blood vessels to boost the blood flow to the infected area. So what's the danger of this disease? Gas gangrene is a very serious condition that often begins unexpectedly and progresses very rapidly. The infection can quickly become life-threatening when left untreated. However, the individual outlook will depend on the overall health, like the severity of the infection, the location of the infection. However, there are some potential complications, such as permanent tissue damage, jaundice, liver damage, kidney failure, shock, widespread infection, coma, or at worst, it is death. And now let's look at the last type of bacterial infection, which is bacterial meningitis C. Bacterial meningitis is a very serious condition. Also, some people with this infection can die, and the death can occur in as little as a few hours. However, most people recover from this bacterial meningitis infection. Those who recover from this disease can have permanent disabilities such as brain damage, hearing loss, and learning disabilities. And now let's look at the causes of this disease. Several types of bacteria can cause meningitis, including Streptococcus pneumonia, group B Streptococcus, Neisseria meningitidis, Haemophilus influenzae, Listeria monocytogenes, and Escherichia coli. And also, some causes of bacterial meningitis are more likely to affect certain age groups. Also, like for example, the newborn might be infected by group B Streptococcus, S pneumonia, L monocytogenes, and E. coli. For babies and young children, they are infected by S pneumonia and meningitis, H. influenzae, group B Streptococcus, and tuberculosis. And teens and young adults also can be infected by N. meningitis and H. S. pneumoniae. And for older adults, they can be infected by S. pneumoniae and meningitis, H. influenzae, and group B Streptococcus, and also L. monocytogenes. And infections that cause meningitis can be spread through sneezing, coughing, and kissing. So let's look at the symptoms of this disease. Meningitis symptoms include a sudden onset of fever, headache, stiff neck, and there are often other symptoms as well, such as nausea, vomiting, photophobia, like the eyes become more sensitive to light, and sometimes you get altered mental status like confusion. And for newborns and babies, it may not be obvious, but or maybe they may not have, or it may be difficult to notice the symptoms like what I have mentioned above. But babies may show like they can be slow or inactive, they tend to be irritable, they vomit, they can feed poorly, they might have a bulging fontanelle, the soft spot on the head, and also they might have abnormal reflexes. And now let's look at the diagnosis of this disease. So if a doctor suspects meningitis, the doctor will collect the samples of blood or cerebrospinal fluid, a fluid that near the spinal cord, and then a laboratory worker will test the samples to see what is the causing of this infection. And by knowing the specific cause of meningitis, it can help doctors to treat it more effectively. So the treatment for the treatment, the doctors can treat this bacterial meningitis with a number of antibiotics. And also it is very important to prevent it. It can be prevented by taking vaccines, because vaccines are the most effective way to protect against certain types of bacterial meningitis. Yes, so this is all from me. Thank you.